Alrighty, hello Brennan again. We're gonna go ahead and do a cranial nerve and deep tendon and musculoskeletal assessment today. Does that sound okay?
Sure.
Okay, so starting out with the cranial nerve, this is the olfactory nerve. We are going to test your sense of smell, okay? So I'm gonna have you close your eyes. I'm going to have you close one nostril. Okay, so you're going to close your right nostril. I'm going to hold a scent up to your left nostril, and I want you to smell and tell me what the scent is.
Okay. Vanilla, I think.
Good.
Hand sanitizer, though.
Vanilla. Okay. So then keep your eyes closed, and with your other arm, close your left nostril, leaving your right nostril exposed. Okay, and then I'm going to hold a scent up to your nose.
Cinnamon-ish.
Yep. Good. All right, so moving on to your cranial nerve number 2. This is your optic nerve. We're going to take a look at how your eyeballs are working, okay?
All right.
So I have my pen light over here and then my Snellen exam chart. You might remember this from previous video. So I'm first going to perform the confrontation exam. So I'm going to stand about arm's length of you. You're going to put over your right eye. I'm going to go over my left eye. And I'm going to go ahead and hold up numbers, and you're going to tell me what numbers you see, okay?
Okay.
I want to ensure I'm not blocking the camera. Okay, ready?
Sure. 3, 2, 4. Can't tell. 4. 4 again. 3.
Okay, we're going to do the same on the other eye.
3, 2, 1. 4. 3.
Okay. And remember, you've had LASIK, so you no longer have contacts. You were wearing contacts previously.
Correct.
All right. So we're going to go ahead and do the visual acuity with the Snellen chart. I'm going to stand behind the camera. That way we are able to perform. Okay. So I want you to cover your left eye and read the lowest line.
Bottom LTF. Sorry, LTF, PH.
Okay. Do the same with your other eye cover.
Same one, LTF, PH.
Perfect. With both eyes?
LTF, PH.
Perfect. Okay, good job. All right, so that was your cranial nerve number 2. That was the optic nerve. We're going to move on to cranial nerve 3, which is your ocular motor. We're going to actually assess multiple cranial nerves within. We're going to do ocular motor, trochlear, and the abducens. So I'm going to look at you with my pen light. I'm going to show the light into your eyes. I'm going to look for reaction, ensure that your pupils respond appropriately, and then I'm going to kind of test your cardinal fields of vision, okay?
Okay.
Alrighty, so I'm going to take a look at your eyes to ensure that there's nothing like nystagmus, anything like that. Good. Pupils are reactive on the left eye. Pupils are reactive on the left eye. Perfect. I'd say your pupils are about 4 millimeters, I'd say, which is good. That's on your left eye. Right eye is 4 as well, so equal reactive round pearl is intact, so great. I'm going to go ahead and do the 6 cardinal fields of gaze. So I'm going to stand in front of you, okay? And I want you to follow the pen light, okay? Don't move your head. Good. Okay. Cardinal field vision is intact of gaze. There's no nystagmus. I'm going to go ahead and kind of dim the lights here. And I'm going to have you look at an object over my shoulder. And I want to ensure that your pupils look okay. And then I'm going to move the pen light towards your nose and ensure that your pupils are accommodating appropriately, okay?
All right.
All right, so I'm going to have you look over my shoulder. Good, okay? And then I'm going to move over this way. I want you to look over my shoulder this way. Good. Pupils do accommodate, they do constrict, they do move inward. All right, so that was your cranial nerve oculomotor, cranial nerve trochlear, and your cranial nerve abducens. we're gonna move on to the trigeminal cranial nerve, okay? So I'm going to have you bite down and I'm gonna feel your cheek, okay? So open, bite down. Good, okay, so I'm feeling at your TMJ and that is working appropriately. I am then going to have you close your eyes and I'm going to take a sharp and dull object and I'm going to kind of poke around and see if you can differentiate between the sharp and dull, okay?
Okay.
Okay, so go ahead and close your eyes. All right, I'm going to assess at the forehead, maxilla, and mandibular area because I want to ensure that this cranial nerve is working appropriately, okay?
Okay.
All right, so are you ready?
Yep. Dull. Like a brush, light. Is that sharp or dull?
Dull.
Okay. Yep. Dull. Is that supposed to be sharp?
No.
It feels like a brush.
Good.
Brush.
Good. All right, so then I'm going to take a piece of cotton and swipe at the corner of your eyes while they're open, and I'm going to check and see the reaction from your eyes, okay?
Okay.
And we've ensured that you don't have contacts in, so I'm not going to take your contact out. Good. And both eyes blink appropriately, simultaneously. So we're going to go ahead and move on to cranial nerve 7. This is your facial nerve, so go ahead and close your eyes. Open wide. Wide, wide. Good. Okay, and then you can relax your eyes and puff out your cheeks. Good. All right, that's appropriate. Alrighty, so we're going to move on to the cranial nerve 8, which is your acoustic nerve. We're going to do the whisper test, the Weber and Rhine test, which you may find similar from previous videos, okay?
Mm-hmm.
Alrighty, so I'm going to kind of stand in front of you. I'm going to have you cover your right ear, and I'm going to leave your left ear open, and I'm going to whisper something, and I want you to tell me what I whispered, okay?
Okay.
Alright.
What?
Baseball.
Baseball.
Alright, do the same with the other ear.
Race car.
Good. Alright, so we're then going to move on to the Weber and Rhine test. So I'm going to move over here to grab my supplies. Alrighty, so first we're going to be doing the Weber test. So kind of familiar from the past is I'm going to enact this and put it on the top of your head here, and you're going to tell me if you can hear it, okay?
Alright.
Alright, are you ready?
Yep. Yep.
Do you hear it in both ears?
Yep. Equally.
Perfect, okay. All right, then we're gonna move on to the Rhine test. So this is where I'm going to strike this against my palm again, put it behind your ear and then up to your ear. Okay, so I'm going to have you tell me when you can hear it, and then I'm going to have you tell me when you have stopped hearing it, okay?
Alright.
Okay, ready?
Yep. Can hear it.
Tell me when you stop hearing it.
No.
Great, I'm gonna move on to your other side.
Can hear it.
Tell me when you stop hearing it.
No.
Perfect, okay. So in this case, air conduction was greater than bone conduction, which was normal. You were able to hear it in both ears upon the Weber test, which was also normal. I'm going to go ahead and move on to cranial nerve 9, which is your glossopharyngeal nerve. So I'm going to again take a look with my pen light. I'm going to have you open up wide. And at this point, I'm going to look at your uvula. Okay, looks good back there. I'm not going to check your gag reflex for the purpose of the video, but gag reflex is noted. Moving on to cranial nerve 10, this is the vagus nerve. Go ahead and repeat after me. You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Perfect, so you're speaking without new hoarseness, which is good. I'm also going to have you go ahead and just take a swallow for me. Perfect. There's no difficulty swallowing, correct? All right, cranial nerve 10 is intact. We're going to go ahead and move on to cranial nerve 11, which is your spinal accessory. So I'm going to hold on to your head while you rotate your head to the side, and I'm going to ensure that I can feel you rotate. So go ahead and rotate to your right. Okay, and then go ahead and move to your left. Good. And I'm going to place my hands on your shoulders. Raise your shoulders up, shrug them. Good. Okay, perfect. That is intact. All right, I'm going to go ahead and move on to the last and final nerve, which is cranial nerve 12. This is your hypoglossal. Go ahead and stick your tongue out, straight out. Move it to the left and to the right, up and down, and go ahead and put it back in your mouth, blow your cheeks up again. All right, and that was appropriate. Cranial nerve 12 is intact, which is great. So we're gonna go ahead and move on to the next portion of the exam. This is the proprioception and the cerebellar assessment, okay?
All right.
So to check cerebellar function, we do a couple things. So first, we're gonna check rapid movement. I'm going to move so that I can show you the proper way of how we do it. Alrighty, so like I said, the rapid movement. So you're going to put your hands on your thighs and you're going to rotate them back and forth as quickly as possible.
Yeah.
Perfect, yep. All right, and then the next portion of this exam is the finger to nose. So I'm going to have you touch your nose with your right hand, perfect, and touch my finger. Keep going. Good, okay. With your left hand this time.
Oh, missed you.
That's okay, perfect. Okay, the next portion of this exam is a gait test. So I'm gonna have you stand up, and I'm going to have you come this way and walk steady towards the table.
Okay.
And then turn around. And this time walk heel to toe. Perfect. Gait is steady. You have no issues walking. You can go ahead and have a seat. And then we're going to do a heel to shin test. Have you ever done this before?
Mm-hmm.
All right, so you're going to take your right heel and run it up and down your shin. Perfect. And then do it the next side. Great. I've not noted any ataxia. Your gait was steady. No weakness noted. Your legs are working appropriately. All right, so we're going to go ahead and move on to check your proprioception. So we're going to do the Romberg test, which you're going to stand up and you're going to cross your arms. And I'm going to be looking at your steadiness. So I'm going to ensure that you can maintain standing like this, okay? So for time's sake, it's been 30 seconds. It's been appropriate. All right, I'm now going to have you close your eyes. And I'm going to have you stand for 30 seconds. And for time purposes, this was great. You can go ahead and have a seat. Alrighty, and so then we are going to go ahead and now do the object test. I'm going to cross the room. I'm going to grab my object. I'm going to put it in the palm of your hand. And with your eyes closed, you're going to tell me what it is, okay?
Right.
So hold out your left hand. All right, I'm going to place something in the palm of your hand. I need you to tell me what it is just by feel.
Paperclip.
Perfect, okay. I'm going to try this in the next hand. Go ahead and open your palm.
Battery.
Yeah, perfect. All right. So we're then going to move on to the 2-point discrimination test. I'm going to have you close your eyes. I'm going to touch you with 1 or 2 fingers throughout your body, and I need you to tell me if I'm touching you with 1 or 2 fingers, okay?
Okay. 1. 1. 1. 2. 2. 1. 2. 2. 1. 2. 1.
Can you extend your legs for me?
1. 2.
Okay, good. And then I'm going to have you hold out the palm of your hand. I'm going to have your eyes closed, and I'm going to be drawing a letter in the palm of your hand, and I need you to tell me what letter it is, okay? Kind of rotate your palm down so that the camera can see as well. Turn the light on real quick so that we could be able to see your palm of your hand a little bit better. So we're going to try this again, okay?
Okay. An S.
Good. All right, I'm going to move on to your other palm.
8.
Good. All right, so we are then going to move on to, I'm going to be positioning your hand with your eyes closed. You're going to tell me what position your hands is in, okay? So it's going to be like an up or down motion, okay?
Okay. Finger pointer up. Pinky down. Middle finger up. Ring finger up. Thumb down.
Good.
Sorry.
It's okay.
Pointer up. Ring down. Pinky up. Thumb down.
Good. Alrighty. So that looked really good. I'm also going to be doing your feet, okay? So extend your foot for me. It's okay, I can rest it. All right, eyes closed.
Toe up. Toe down.
I'm gonna move on to your left foot.
Down, up, down, up.
Good. All right, that was appropriate. You were able to tell me and distinguish which phalange was up and down, which is great. We're gonna move on to deep tendon reflexes, okay?
Okay.
Alrighty, so I'm gonna pause that. Okay, so we're gonna move on to your deep tendon reflexes like we described earlier. So I'm going to be taking a look at your biceps, brachioradialis, your patellar, your triceps, and your Achilles tendons, okay?
Alright.
So I'm gonna start with your biceps. So I'm going to extend your arm on your right arm. I'm going to kind of use my marker here to tap to ensure that you have deep tendon reflex, okay?
Okay.
Good, okay. And then I'm gonna go ahead and on the same arm do your brachioradialis as well. Okay. And then I'm gonna move to the back of your triceps. Good, okay. I'm gonna move to your other arm and repeat. Good. I'm going to have you remove your watch so I can get good access here. And I can hold that in my pocket if you'd like.
Sure.
Okay. And then I'm gonna rotate your arm here. Good. I'm gonna bend your arm. Good. All right, and then I'm gonna have you extend your left leg. I'm gonna kind of hold it down here. Go ahead and, yep. Okay. And then I'm going to get your Achilles here. Good. All right. I'm gonna move to your right leg. Good. And then I'm gonna move back to your Achilles here. Good. Okay, you can go ahead and put your legs down. So there we assessed the biceps, brachioradialis, the triceps, the patellar, and the Achilles deep tendons. Each reflex was about +2, which is normal findings. I'm going to go ahead and with your feet, I'm going to have you extend them if you can.
Like that?
Yep, and I'm going to have you do a dorsiflexion and a plantar flexion. So that's basically looking at your ankle joint. So pull your toes up towards you and then extend them like a gas pedal. Good. All right, go ahead and do it on that side as well. Okay, so I'm going to have you actually lift your leg. That didn't cause you any pain, right? So I'm going to do it for you very quickly. Relax that ankle joint. And then I'm going to let it relax. Good, no clonus. All right, I'm going to move to your left side and I'm going to do it for you as well. Good, no clonus, which was appropriate. Good job. Alrighty, so then we're going to move on to the Babinski reflex. I'm going to take the sharp end of my mallet here and I'm going to run it up the palm of your foot and it's going to see if your toes fan in or out, okay?
Okay.
Right? Good. Alright, toes did not fan out, which is a normal finding. Alrighty, so abdominal reflexes were evaluated with normal findings, which was also good. I'm going to move on to the musculoskeletal system. So first I'm going to inspect and palpate the musculoskeletal system. So I'm looking at you, everything seems symmetrical upon visual inspection. Don't see any masses, lumps, bumps, no abnormalities. I'm going to go ahead and inspect the skin over your muscles and joints as well. Everything seems symmetrical so far. Muscle tone is appropriate, contour is appropriate, color is normal for ethnicity. Tone appears well, like stated. I don't see any swelling, masses, or defects. I'm going to go ahead and begin the process of palpating. And I'm going to look for muscle tone, warmth, tenderness, swelling, or any crepitus. So I'm going to start feeling. Okay, good. Okay, move to your left side. Okay, good. I don't feel any crepitus. I'm going to move to the back of you. Okay, everything seems symmetrical. symmetrical, muscle tone is appropriate, contour is appropriate. I don't feel any crepitus, swelling, tenderness, nothing of that sort. Did you feel any tenderness?
Mm-hmm.
Okay. Skin was warm, dry, and intact. I didn't see any skin issues there as well. I'm going to go ahead and test each major joint for active and passive range of motion. So if you can, raise your arms up to your side. Kind of rotate your shoulders. Good. And go ahead and bend your arms. Bend them back out. All right, and I want you to rotate your wrists. Can you touch each finger to your thumb? And go ahead and fan your fingers out. Pull them in. Good. All right, I'm going to have you stand. Can you move your left leg in and out? You're going to abduct and adduct. Good. All right, do the same with this leg. Good. Can you squat down? And stand back up. Ooh, lots of cracks there.
Lots of cracks.
Touch your toes. And stand straight up and stretch out tall. Good. All right, you can go ahead and have a seat. I'm going to have you rotate your ankles like over and rotate.
Like that?
Yep. How does that feel?
Fine.
All right, and do the same with your left leg. Good. Okay, so each major joint was tested for active and passive range of motion. Oh, I did forget go ahead and rotate your neck. Does that feel okay?
Couple cracks, but
Okay. All right. So I'm going to go ahead and test your muscle groups for strength and compare sides. So I'm going to have you grab my hands and squeeze. Pull me toward you. Push me away. Good. Grasp were equal and strong. I'm going to go ahead and also have you do your gas pedal. So go ahead with both legs, and I'm going to hold on to your toes.
fall out of this chair, that'd be funny.
Press against. Good. All right, and then I'm going to have you pull. Good. All right. It was equal, strong. There wasn't any limb that showed weakness or any moderation, which is good. Your feet and ankles during weight bearing and non-weight bearing exercises were appropriate contour aligned with your tibias, normal size. You have 5 toes on each side, which is normal findings. Anything to add for the rest of the exam?
Mm-hmm.
All right, perfect. Well, thank you for your time.
Yeah, thank you.
All righty.